Good morning, everyone. Thank you for joining us for our office hours today. We're going to give it just a couple more minutes before we get started, but thanks so much for joining. Hello, everyone. Good morning. If you're just now joining, welcome to today's live office hour webinar. In this session, we're going to offer the opportunity for you to ask questions either verbally or in the Q&A chat feature. So we will cover common and new questions around data submission and 2022 recognition in our outpatient programs, target BP, check change control cholesterol, and target type 2 diabetes. On behalf of the American Heart Association and American Medical Association, I want to thank you for taking the time to join today. I am Liz Montgomery. I'm a healthcare data analyst working with the AHA and AMA on all things outpatient. And I'll be presenting some of today's slides and answering questions alongside my colleagues Allison Smith and Sarah O'Kane. Allison, would you like to introduce yourself first, and then we can have Sarah introduce herself?
Sure, thanks, Liz. I'm Allison Smith. I'm the Program Director for Target BP, a nurse and a public health professional on behalf of the American Heart Association and the American Medical Association. We're delighted that you all are joining us today. Thank you very much for your commitment to recognition. And I'll turn it to Sarah O'Kane.
Thanks, Allison. This is Sarah O'Kane. I am a healthcare data manager with the American Heart Association and American Medical Association. Just really responsible for overseeing our 3 outpatient recognition programs, as well as kind of our other programmatic pieces that go along with our outpatient work, including our registry build. And so happy to help answer questions and looking forward to seeing all of the data submissions this year.
Thanks, Allison. Thanks, Sarah. Yes, welcome everyone. So before we dive in, we're going to review just a couple of housekeeping items. So first, in a little bit, all participants should be able to come off mute to voice questions. We'll have a dedicated Q&A section for this, actually a couple of them throughout the presentations. In between those Q&A sessions, you can type your questions into the Q&A or chat feature, and we'll be monitoring those and calling them out throughout the presentation. Within a couple of days after the webinar, we will be emailing the slide deck and recording out. So immediately after the webinar ends, the survey will appear. It should only take a couple of minutes to complete, and we'd appreciate any feedback you can provide to help us improve our webinars. You'll also get a chance to ask additional questions if you think of them, right as this is ending. But also any general questions after the webinar, you can send them to our Contact Us form, which is at bit.ly/AQContactUs or on any of our program websites. So let's go ahead and get started. All right, so for today's agenda, we have just wrapped up our introductions. Next, we will open the floor for any immediate questions that have come in through the chat in case you have a specific question and maybe you aren't able to attend the whole meeting. So we'll start right off with questions. And then once we get through those, we'll have a few slides that cover our timeline, reminders, and some of our available resources. that might answer additional questions you may have. Following that, another open Q&A, and then we'll move through some more of those common questions that we get in the past for additional Q&A as they come up. So again, while we're having the open Q&A session, please come off mute. But as we go through slides, again, it'd be helpful for you to stay on mute and type them instead, and Sarah or one of us will read them off. So I'm gonna move ahead to that first Q&A session. Have any come in through the chat yet? And I'll go ahead and unmute everyone if anyone wants to come off mute.
So far, Liz, I'm not seeing any questions in the chat function or in the questions function. I'm also scanning the participants list for anyone wanting to raise their hand and unmute, and I'm not seeing anyone at this point, but we certainly have, as you mentioned, several points along the way for questions.
Yeah, we can give it just another minute if anyone wants to go ahead and raise their hand if they have a question.
I do see one question from Jill asking, we've not received our UDS data from HRSA yet. Is there another way to get that information? I'll start by saying I'm not aware of another way to get that information from UDS, but typically organizations get that data from their electronic health records. I don't know if others want to weigh in on that question.
Yeah, I would say that is correct. Typically, the data that you would be submitting to UDS is the same kind of information process. So we can cover a little bit more about that information, but it's probably going to be coming from your EHR.
Yeah, a report function. Another question was raised in the Q&A section, and I know we have a discussion of this planned, and Nikki asked related to the target BP question number 8 for patients that list race as unreported or unknown. What if they also don't report the ethnicity? And so we have a special slide that explains that, I think, a little more visually clearly coming up in a little bit if we want to pause on that question.
Excellent, thank you.
It's a great question. You are not alone.
Thank you.
If you're able to hold on for just a little while, it might make a little bit more sense in that context.
Yep, I am, thank you.
Okay, great. All right. Then maybe we can go ahead, and that was all for now, right, Allison?
I'm not seeing any others. If you are, Sarah, I'm just scanning again.
No, I just saw those two. And then Jill, just let us know if you need more information on the UDS data question. We can always chat offline if needed.
And yeah, in the Q&A section, we should be able to see those as staff members. So if you did want to drop your email address or contact like there, we can follow up with you afterwards if you prefer. All right, so I'll go ahead and move on, but if you do have questions, please feel free to just keep dropping them in the chat, and we can pause if it makes sense, or wait until that next Q&A section to address them. But moving on, we can go into the recognition timeline and some of those basic reminders and resources. So the data platform, as hopefully you all know, is open right now for 2021 data submission. And the deadline is Friday, May 27th at 11:59 p.m. Eastern. You can revise your data, change your data at any point up until this deadline, but what's saved at that time is what will be used to determine everyone's award status. So also please note the Eastern time zone. We know it'll be a little earlier or later, depending on where you're working from. We also want to encourage you to submit your data early, given the unknowns that we've seen the last couple of years, around the pandemic or any other technical issues that might come up in the next few weeks. We'll be taking a few months after that data submission to review submissions and notify awardees during that September and October timeframe. with what your award status is. There are many benefits to participating in these outpatient programs. Awardees for Target BP are recognized in annual AHA and AMA meetings, and all program awardees are posted on our program website, in some publications, and we have a press release and comprehensive promotional toolkit to help you promote your achievement as well. So let's talk a little bit about the eligibility criteria. And the outpatient programs are intended for organizations that are directly providing patient care for chronic diseases. So to be eligible for an award in 2022, or of course any future years as well, the submitting organization must be diagnosing and treating patients up to and including prescribing medications. So the vast majority of organizations are doing this, but for the handful who are in more of a referral or educational role, we do have some spotlight opportunities to highlight your organization's important contributions. For those kinds of opportunities, we'd ask you first reach out to your local directors, so whoever you're working with in the community from our team. All right, and move forward. So getting started, there are two basic steps to submit data for recognition. The first step is to register. This enables us to create a profile and user login for you in the online data platform. If you're new to submitting data, please go to our URL, which is on screen now, the heart.org/registermyoutpatient.org, to register your organization. In this form, you can register for one or all three programs at once. If you're debating if you just want to do Target BP and maybe one of the others, it might be easiest to start by registering for all three, so you don't need to go back in to re-register for the other programs, especially as we get closer to the deadline. But if you've submitted before and you already have a profile, you don't need to re-register unless you're wanting to add new forms. You can skip straight to entering data, which we'll cover in the next slide. So I'll also note while we're on the slide that one registration equals one potential award. If you want your health system and each of its individual locations to all be listed individually and each receive recognition, you'll need to submit registration forms for each of those locations. But if you wanted to register 5 or more sites, we do have a multi-site submission process in that link that does save a little bit of time for you. So step 2 is that once you receive your user credentials by email, you can head to our online data platform. You'll navigate to program forms, hit add new, enter 2021, because you're entering data from calendar year 2021, and then fill in all the fields and hit save and exit. So again, the deadline to enter and finalize your data is May 27th at 11:59 p.m. Eastern. The minute after that, we get a snapshot of all the data in the platform, and that determines everyone's organizational award level. So this will go ahead and lead us to doing a quick overview of the specifics for each program, including that one question on race and ethnicity. But before I pass it over to Allison, was there anything we could cover before jumping in? Let's take a look.
There is one question about being able to see which clinics had submitted previously, if it's a new user of the platform. And in general, you know, we post the previous participants on the Target BP website with a comprehensive listing, but there's probably a way within the platform that I'll defer to my colleagues that and how to see previous submission data.
So I would work with, my first suggestion would be to work with your local AHA director, or you can reach out to us again at that bit.ly AQ contact us link, and we'll reshare that here in a little bit. But you can ask, just share the information about your organization, and we can let you know if you're already registered, who we have on file as that contact, and you can see which forms you've already registered for and which ones you might want to add, or if you have additional locations you wanted to add. But that will help you log in and be able to see what you need to and identify what areas you might want to add. But so generally just reach out to us and we'll help you navigate, because there might be an organization that didn't submit last year, but say submitted 2 or 3 years ago, and you wouldn't see them at a glance on our recognition site. So let us know. Help you out.
Thanks, Liz. There's another related question, an individual asking whether primary care or specialty care sites typically participate, and we certainly, it's a great question. We certainly see both. Some organizations, opt to register individual practices. So the primary care clinic, a family medicine or internal medicine clinic, or a multi-specialty clinic, or a cardiology or nephrology or a clinic separately, or under the sort of aggregated together as one organization. But I don't know if you want to add anything in response to that as well.
No, I think that covers it. Yeah, we see a range of different organizations, as long as they're treating the chronic condition that they're submitting data for. So certainly some hypertension clinics submit data for target BP and not, necessarily check change control cholesterol. But yeah, I think you answered that great. Yeah. Thanks, Allison.
And there's a related question here about registering individual sites versus sort of groups of sites. And I think later on you're going to talk a little bit about the uploader. So I don't know if you want to make a comment on that now or pause and address that later.
I'll talk a little bit later about what that will look like if you're doing the multi-sites. But essentially, it's that if you have a health system and you want each of your separate clinic locations to be recognized and to be able to compare them and their data within the platform, then we'll set up what we call a facility ID for each of those locations. That is really up to you. If your organization, say for capacity or the way that you're looking at your data, prefers to submit as one health system, we would just submit that as one facility ID if you didn't want to separate out the data that we're going to walk through. But just keep in mind as we go through the next slide that however many organizations you want to recognize, whether that's one for your whole health system or multiple for different clinics within your health system, the data being asked for in the next slides is going to be asked for each of those at the ID level. I hope that makes sense.
Yeah, thanks.
Screenshots that'll hopefully make it look a little bit more sense as we move forward too.
Thanks, Liz. And then just one other kind of introductory question that looks like Sarah may be answering already, is just in case there are other new users. There's a question about whether there can be multiple users per organization.
Yes, absolutely. You can have multiple data submitters for an organization, whatever makes the most sense for your organization. So if you're splitting up how you're answering the questions between different staff members, or somebody needs to just look at it and another person is submitting, but you want to share that information, we can set up multiple users, no problem. Just reach out to that bit.ly/AQ contact us link again, and we'll get you set up. All right, let's go ahead and move forward, and then we can circle back around for more questions, but I think the next few slides will probably help answer some of them that are coming in. So Allison, would you mind taking it away on target BP requirements?
Yeah, so let's dive into target BP data submission requirements. These are very similar to last year if you have participated previously. In general, we're looking for the first 6 items listed here are what help shape the control rate related recognition. We're looking for your total adult population, ages 18 and older, the number of patients with the diagnosis of hypertension, and a 2021 visit based on the MIPS definition for the controlling high blood pressure measure. We're looking for total number of patients diagnosed with hypertension, again, based on that measure. We do ask a question about whether or not any of those readings include remote blood pressure readings, either transmitted electronically, and we'll talk about that in a little bit more detail because there's some nuances to that. We also are interested in the number of providers in the institution from whom you're, or the clinic from whom you're submitting data, meaning anyone who is in the role of diagnosing and treating hypertension, so advanced practitioners, physicians, and then also looking for the distribution of your patients' primary payer groups. And there is some specific guidance on the data collection worksheet that helps think through that. They're just some high-level categories, and that really helps us appreciate some of the diversity and complexity of the patient population that you are serving. New in 2022, highlighted here at the bottom, we have simplified, streamlined the race and ethnicity questions. Historically, we used the prevalence estimator that had 45 data elements in order to complete it. Now we've narrowed that down to 16 fields, and that aligns with the way in which data is reported for UDS. So for those of you who are UDS reporters, this will be a big leap forward in simplifying the process. We've also made a tweak to one of the questions related to the evidence-based blood pressure measurement criteria questions around validated devices. That's just a drop-down menu instead of a fill-in-the-blank kind of question. So that should be a little easier. So, and just keeping in mind that even for those of you who have control rates that are less than 70%, we really continue to encourage you to participate in Target BP, to use the resources for quality improvement, to work toward silver, gold, and gold plus. It is a journey. So, and then just one other footnote, just reminding you that the recognition is for the organization or the clinic, not the individual practitioner, which is a little bit different perhaps than you may be familiar with the Million Hearts Award. So with that, moving on to the next question, and this is again related to a question that had arisen about using home blood pressure measurement data as part of your Target BP data submission. And yes, that is permitted with a few sort of nuances that are outlined here. Actually, this has been true since 2021, so it was true last year and continues on, that eligible telehealth encounters are allowed to be included in that blood pressure measurement data, with the caveat that the readings are taken on an automated device, not a manual device, that those readings are stored in the device with the time and date stamp, and that they are either seen by the provider on a video, you know, the readout on the screen, or that they're transmitted electronically to the provider. So in other words, so that the patient isn't able to edit them. It's actually what's captured by the device. They also have to have a diagnosis, you know, anytime during the reporting period or prior. So hopefully that, we know there's been such an uptake of SMBP in the last few years during the pandemic that we're delighted that this measure has been edited to include that data, but again, under certain conditions. All right, with that, moving on, and this is, I think, sort of an important clarification about date ranges. This is a little tricky here, so the highlights are really helpful. So we asked in question 4, what is the number of patients who had a visit in 2021 and a diagnosis of hypertension between that 2-year period from January 20 to December 2021. So again, there's a little bit of a nuance here. So the patient visit would occur during 2021, but the active diagnosis could have been present during that 2-year period. So hopefully that helps distinguish the patient certainly as having an active diagnosis, but also having had a visit during the last year. All right, with that, I think we'll move to the next common question that we've encountered. When we think about the other data submission requirements, is about attesting to evidence-based blood pressure measurement activities. This is sort of the cornerstone of the M in the MAP framework, of measuring accurately. And we are really looking for mostly yes, no, or unsure responses. So it's really oftentimes these questions are best answered by some of the clinical leadership in your in your institution, whether it's physicians, nurses, quality improvement professionals who are familiar with the way in which your organization delivers care. And so the questions ask first about whether or not you regularly calibrate your blood pressure devices, and the frequency of that calibration is determined by the type of devices you're using, whether they're oscillometric or aneroid, meaning manual or automated devices. So if you are calibrating them according to those recommended timelines. There are resources, by the way, online that point you directly to the guidelines and the AHA's BP scientific statement on the frequency with which those devices should be calibrated. We also ask if you are aware if your devices are validated for clinical accuracy, and we point you to some resources to compare your devices to those that national validatebp.org listing. And if so, if they are validated, what percentage? There's not a requirement or a minimum requirement of percentage. We're just trying to direct people to this new resources and encourage organizations to acquire validated devices, since that is the standard of care. And I will just also note that having a validated device is different from having one that is just FDA approved. FDA approved is just a basic safety requirement, and actual validation status is that those which have been tested for clinical accuracy. So we want so question 2 refers to validated clinical devices, blood pressure measurement devices. Questions 3 and 4 have to do with whether or not you are training and testing your staff in blood pressure measurement every 6 to 12 months, again, aligned with the guideline. So that's within that calendar year of 2021. Did everyone have training and testing related to blood pressure measurement? And question 5 is regarding the use of a protocol for confirming blood pressure measurement. That could include repeating a measurement in office, using self-measured blood pressure to get out of office readings, or ambulatory 24-hour ambulatory blood pressure monitoring. And then lastly, the question 6 asks if you use a visual reminder for proper positioning in every place where blood pressure is measured in your clinic. So that could be the infamous red or purple graphics, or there are other positioning graphics that are available to help remind your team as well as patients to collaborate in best practice. All right, with that, I think we're moving on.
Thanks, Allison. Here is the question that was posed earlier in the call, and I'll take this one. So we do have this new race and ethnicity table that Allison mentioned earlier, and this is not just for Target BP, even though that's what we've covered so far. This will be on all of the 3 program forms. So it is asking for an adult patient breakdown of race and ethnicity based on, again, Table 3B of the HRSA UDS reporting requirements for 2021 health center data. The UDS table is actually pictured in the screenshot on the left, and our form from the data platform on the right. We have gotten a couple of questions like we had earlier on the call regarding partial data for patients who identify either their race or ethnicity, but not both. In this scenario, we're going to ask that you add these patients who have either an unknown or not disclosed race or ethnicity to the unreported unknown total patient count field. So if somebody says they're Hispanic but does not identify their race, they would fall underneath that count. We do recognize this isn't an exacting representation of race and ethnicity, but this was part of the choice to align with national standards to reduce the time that organizations spend pulling and inputting this data annually. So part of the move from over 40 questions down to 15 questions. We also removed the, we used to ask for additional sex and age criteria, but we heard that this was a barrier to participation, having to break down the data in this way. So we did choose to move towards reporting in this manner, but I'm hoping this answers the question. If you do have any other questions on how to fill this out, please feel free to let us know, but I'm hoping this covers it. All right, so I'll go ahead and move forward, but if we need to circle back to this slide, we can. We've got just a few more slides in this part, and then we'll have open Q&A again. Moving to the next grouping is a similar overview that we just went over for target BP, but for track change control cholesterol. So our requirements this year include aggregate 2021 data for all adult patients ages 18 years and older. These include fields for the adult patient population, again, the number of providers, and a breakdown of the patient's primary payer groups. Like Allison said, we do have additional resources on how to break down that payer group that can be pretty helpful. The patients meeting any of 3 risk group criteria for ages 21 and older, which is different than the first 3 questions, which look for ages 18 and older. And then of those patients, what is the total who are actively using or who receive a prescription for statin therapy at any point during the measurement period? We'll also ask for information on your use of the ASCVD risk score. So we're asking you, how is it calculated, but also how is it documented? And we had 2 changes to the program form in 2022. The first is a new question that will ask you about your treatment plans for managing very high-risk patients. And then the second is that we will be adding that same race and ethnicity question we just discussed. And for target type 2 diabetes data submission requirements, the first 3 fields for aggregate patient data for adult patients 18 and up are the same as check change control cholesterol. Additionally, we'll also ask for the total number of patients with a diabetes diagnosis and an office visit in 2021, and the total number of patients diagnosed with diabetes whose most recent HbA1c level performed in 2021 is less than 9%. We'll also ask for information on your protocols for target type 2 or for type 2 diabetes patients. Does your practice have a specific protocol to assess key characteristics of patients with type 2 diabetes? And if you do, what are those characteristics? And then does your practice initiate a specific treatment plan for patients with type 2 diabetes? And if yes, how? So the only new addition this year is that race and ethnicity table for target type 2 diabetes. But one other thing to keep in mind when you're entering data for target type 2 diabetes is that we also ask you to submit for either the statin therapy measure submission or the controlling high blood pressure measure submission. One of these is required for an award for target type 2 diabetes. You don't need to do both, but you have to do at least one of them. And they do have different age ranges, so I'll just mention that before we move forward. All right, so to help you prepare for data submission, we do have a suite of resources to help out in addition to this and previous webinars. We have our data collection worksheets, which break down all of the question fields in detail. This is where we have that additional information on the payer group question, and they are available for all 3 programs online now. So you can consider who within your organization should be consulted for different questions. It's really helpful to take a look at this before you get into the platform and start going through them. For example, when you are filling this out, the person who's pulling your data numbers for total patients, or as you're mentioning before, like how does this break down at the patient level, that person might be different than who is familiar with your staff training practices around blood pressure management. So you'll want to look through this and kind of think through who is the best person to ask. We also have a PDF quick start guide that'll walk you through the data submission for all 3 programs. So that really gives you screenshots of walking through the platform. And all of these are on the program website, in the library, on the online platform. We've also added them as attachments to today's call. So you should be able to find them under the handouts feature on your toolbar. In addition to those, we do have step-by-step walkthroughs of navigating the data platform and submitting data. So you can visit our quality healthcare playlist on YouTube or visit our program website where you can find a how to submit data tutorial for each of these outpatient quality programs. We also added a PDF with all of the links for these and that handout feature, and there are quick and full walkthroughs of each of the different program forms and how to walk through them. For the evidence-based BP practices, we've added additional resources, including an FAQ and examples that go more into depth. You can find them pretty easily by going to the Target BP website and the recognition program page, and just click on the link with the levels of recognition graphic. A quick reminder while we're here that this year participant award is only going to be available to first-time data submitters who fall below that 70% BP control threshold and do not achieve 4 of 6 activities. If you are working to achieve silver or gold plus, though, our teams are happy to work with you to get there for next year if you're not there already. A couple of tips. The main thing is that we don't want a technical glitch or a forgotten field to block you from being recognized. So some quick reminders: enter your data by Friday, May 27th, but the earlier the better. If you're new, register early. It can take a couple of days to set up your profile. And when you're entering data, use our resources for full instructions. Complete all of the fields and all tabs, meaning no blanks. So if you're entering your patient information, enter that 0. Don't leave that field blank. And at the end, check the data entry complete checkbox when you're finished. If you cannot check the data entry complete checkbox, it means there's required information missing somewhere in your form. And then make sure your data is all saved again before midnight on May 27th Eastern time. I'll also mention I did say it can take a couple of days for your registration to get set up. We try and get them in quickly, but it might take just a little bit longer if you're submitting for multiple organizations together, which I will go through in a minute. All right, a couple more tips is that you do need to make sure that you answer yes on the first 2 questions if you are looking for award eligibility. So if you're looking to be recognized, you'll need to answer yes. This is basically where you're attesting that 1, your organization both diagnoses and manages patients with the risk factor being mentioned, and then 2, that you are a representative for your organization and are being honest to the best of your knowledge. For check, change, control cholesterol and target type 2 diabetes, you'll also be asked if you're committed to improving, and you need to answer yes again to be eligible for recognition. You can fill out the site characteristics questionnaire for additional benchmarking functionality, so that'll be helpful for different comparisons, especially if you do have multiple sites, or if you just have one site, you can see how your organization compares either within your state or nationally or within those different characteristics. I also wanted to remind you that each program form has 2 tabs of data to enter, which is pictured here. For Target BP, the questions for Silver or Gold Plus award eligibility are located on a second tab that is labeled BP measurement activities. All questions on this tab must be answered regardless if you're working towards these awards or not. So you can answer no or not sure if they do not apply to you, but you do need to answer them. And then for check, change, control cholesterol and target type 2 diabetes, the second tab will include the measurement submission for which your awards will be based off of. And we did mention earlier this self-service bulk data upload option. It's a mouthful to say. This is the multi-site uploader tool that you may have heard of. This is just a speedier way for organizations to submit data for multiple individual sites in one swoop. It's through this upload tool that allows you to essentially just type your data into a spreadsheet and upload that spreadsheet versus typing them individually into each program form. This is a quick preview of what that upload function looks like in the platform itself. You'll just populate that template CSV file and drag and drop it into the platform. And then like our demo videos earlier, we do have additional videos specifically on the uploader tool, but you can always also reach out to us with questions, and these links are in that same handout we mentioned earlier. So I know we had a lot of slides there. Hopefully that answered some questions, but I have seen more questions pop in there. Allison, Sarah, have you had a chance to look for any we wanted to call out first before we open the line for verbal questions?
Sure. There was one question that we were able to answer everything in the question box, but just to verbalize the answers, we just had a clarifying question about the race ethnicity fields, asking that if that was just restricted to the patients with a hypertension diagnosis or if it was the total patient population. And just to clarify, those fields are tied to your total patient population, and it's for your total adult patient population, so ages 18 and up. So just keep that in mind in case you happen to have any under 18 patients, that those should be excluded from the count and excluded from the race ethnicity fields. And then about the target type 2 diabetes questions, I don't know if you want to flip to that slide where we listed the fields that are in target type 2 diabetes. Just to clarify on this one, because I think it's not on the slide, but it is in the actual question in the platform and on the data collection worksheet. For the HbA1c poor control measure, for the numerator, we are looking for patients whose HbA1c level is greater than 9% or they didn't have an HbA1c level taken, or like it's unknown. So that should align with UDS and any other measure submissions you're doing for the poor control measure. So just wanted to answer that particular question. And then I think that was it, unless Allison, did you see any other ones?
The only other one I was going to mention, there was just repeating the contact for setting up a new user account, which I believe is the Infusario outcome support at quintiles.com. Is that correct?
You could do that, or the bit.ly link, which I can put in the chat again. It's the bit. And we'll send that out right now. It's the bit.ly /AQ contact us. Or you could do Infusario outcome support. Oh, sorry, what was that, Liz?
I was just saying, it took me a minute to find the slide, but it is on screen now if you wanted a visual of those.
Perfect.
All right, well, if that wraps up the Q&A that we have in the Q&A feature, maybe we can give it a minute if anybody wanted to come off mute to ask a question. Let's see, got any hands raised, but please feel free to just go ahead if you do have a question.
Not seeing any at the moment, but keep the questions rolling. This is for you all to make it easier.
Yeah, so again, you can have, here are a few ideas if you did have questions on any of these topics. Self-service upload tool, again, that multi-site option or data submission requirements. But if not, I can go through we can start going through some of our common questions and see if any more come in.
Actually, one did just pop up, and it was really just a question about how much time data submission typically takes. And as you might expect, it depends on the electronic health record that you're working with, how many programs you're participating in across the three here, and how many organizations or clinics, I should say, are participating. And I don't know if you want to embellish that answer a little bit more, Liz and Sarah, from your experience.
Yeah, oh boy, it's a tough question. I've definitely gotten this before, and I've heard from some organizations that they already have reports set up in their EHRs that are close to our questions, and so they're able to use that and go through, you know, maybe in an afternoon with a couple of people, you know, breaking everything down. But for some, you know, small healthcare centers who might not have that same EHR functionality, they might be going to different, you know, somebody, a nurse, you know, organizer for like, how is the training managed? You might have to dig out that question. And part of this process is, you know, discovering where, you know, where you can make improvements for this to be easier to find from year to year. But the long and short of it is it so depends on your organization, and sometimes it can take a while to go through the questions. A long way to not have an answer, but that's kind of where we're at.
But there is an incentive to submit year after year because it gets easier.
Absolutely. Absolutely. All right. I'll go ahead and pull up some of our common questions. So Allison, I'm not sure if you wanted to take some of these Target BP. I'll go ahead and ask you, so how do I attest to completing 4 of 6 of the evidence-based BP activities for Silver or Gold Plus?
Thanks, Liz. We certainly, you had illustrated on a prior slide how there's a separate tab in the platform dedicated to those questions. And each of them are essentially a yes, no, or unsure. You have to answer yes or no to be eligible for that award. Unsure, sort of, you have to say unsure if you're not interested in participating in those plus activities. So you can opt out of that aspect of it, but you do still need to register a response. We don't require proof of documentation. This is the honor system to ensure that you're adhering to those best practices, and in the spirit of quality improvement, you know, we hope that you'll work towards 4 or more, or you know, ideally all 6 of those, since they are guideline aligned practices.
Thanks. So I think you kind of just answered that second question too. If you don't know the answer, we do have a not sure option. Of course, we'd like that to be an incentive to find the answer and to move towards that practice. But
yeah, we talk about hypertension, or, you know, frankly, any clinical care as a team sport, and the same is true with sometimes with submitting your recognition data. While your IT and QI teams may be essential to getting your hands on the right data, some of these practice questions about evidence-based blood pressure, you know, require the partnership potentially with your clinical team to appreciate sort of what the standards and practices are in your institution. So hopefully with that team of input, you can complete your submission.
Great, yeah, and I'll just mention now, I see that we are at time. I think we're both fine staying on to answer some more questions, but I did want to thank everyone for joining, and please feel free to continue to ask questions. But if you do have to hop off, since, you know, we're trying to keep this a little shorter, under an hour, please feel free to reach out using these links at any time with questions, or your local AHA staff. If you don't know who that is, reaching out any of those top 3 links, we can get you in contact with them, so you do have some local support. So thank you, everyone. And again, we will send out the slides and recording, but just wanted to mention that if you do have to hop off early, but we do have a few more common questions I'll bring up to the top that we can mention in, for a couple of more minutes, if you're good to stay, Allison.
Sure.
All right, so what if they don't capture race and ethnicity? What would your suggestion be for them?
I would pause and really encourage you in the spirit of quality improvement and improving, really improving health outcomes, and we've to try to collect race and ethnicity. I think most certified HRs it's a sort of requirement of their functionality, and we encourage you to use it. It's really an important part, and as I said, in improving health equity. So, but in the event that you can't easily get at that information, we do have the option to placing all of your data actually in the unknown grouping. But we really encourage you to look at that information and use it in your efforts to improve health equity.
Thanks. I did see a question come in while you were providing that answer regarding the requirements for the participant badge. And I'll mention we do have a participant award for all 3 programs. For Target BP specifically, that this is the one we called out earlier because this is only going to be available for first-time submitters. The participant awards for check, change, control cholesterol and target type 2 diabetes will remain the same. But for Target BP, it will be for anyone who has not yet submitted data for the program, but does not reach that 70% threshold that would bring them into the Gold or Gold Plus status, and also was not able to complete 4 of 6 evidence-based BP practices. So essentially, we're encouraging you, if you are an organization who has not been able to, we're encouraging all organizations, but in particular, those who might not be able to reach that 70% threshold, we want to recognize the work that you're doing as an organization to improve blood pressure control, even if achieving that rate is very difficult. So that is why we have this silver status as kind of a stepping stone and to recognize your achievement. Allison, did you want to say anything else about that? About these awards? Or
we just really encourage organizations to participate no matter where they are. And I think you mentioned earlier, Liz, you know, a lot of times organizations are only coming in contact with the platform during recognition data submission, but it's really a useful tool to help look at comparative information and get you to that next level over the course of the next year. So we appreciate you participating at any level possible and continuing over time to manage the chronic disease, you know, the chronic conditions that this platform addresses.
Thank you. Yeah, and if you do have questions about our other recognition status levels, we do have FAQs we can send out, and I'll include those details in the follow-up email just to make sure that you have all of the relevant information at your fingertips. I don't have a slide on those this time around, but we can certainly answer if you want us to go into the detail on any of the other recognition levels as well. Just let us know in the chat. All right, were there any other? I didn't see any others come in. But I still have quite a few people here. Maybe we can cover some of the common technical questions that come up, just to highlight real quick before we have to wrap up in a few minutes. So one common technical question is, if your organization's name has changed, how do you update that for recognition? So this is something we do see year to year, and you can contact us at that same link we keep mentioning to ensure that we do have that appropriate name reflected. If you have undergone like a merger or other major legal change, we may need you to re-register just to get the correct permissions for our platform. And then if you have been participating, say, in Target BP, but want to submit for cholesterol and or diabetes data this year as well, you can go to our Register My Outpatient org website. So whenever you go to that link, you will be asked, what are you already participating in? And then what would you like to add? So you can do that. So it'll ask you those in the first couple of questions. So you don't have to re-register your whole organization. You'll just be adding some new program forms. But again, in that same link, you'll be able to find the multi-site registration link, which is separate if you were wanting to register 5 or more organizations at the same time. Okay, and then another common question is if you can't log in, say it's been a while since you've been in the system and you can't find your password, or if you are replacing a staff member, you can again reach out to that same link. You can also try the password reset options or contact our IT vendor if you already do have an account but aren't able to log in. There are questions, so we do encourage you to submit your security questions that will help you reset your password if you do forget it. So I will encourage you to do that. What other things have we not highlighted yet? All right, so yeah, so there's a question on how to update your patient population numbers since you registered last year and where you can do that. And we do ask during registration what your numbers are for your total patient population, but those are just for internal tracking. So the only place you will need to update your different patient numbers are going to be in the actual data platform program. So that's included within all of the data collection worksheets. I think that covers most of our, I think just about all of our main common questions. So unless you have seen any others, I'd be happy to go ahead and wrap up today's call. Just check one more time in the Q&A feature.
I'm not seeing any others at this moment.
All right, well,
I'm looking for hands raised either.
all right, well then I will just say, please again, don't hesitate to reach out with additional questions. We'd love if you could answer the survey link that comes up when you leave today's call. And just we really appreciate not only joining us today, but also your data submission and your commitment to improving the quality of healthcare. And we look forward to recognizing your hard work that you're doing throughout the year during our award season later this fall. So thank you so much and have a great rest of your day.